Understanding healthcare terms. Your healthcare benefits plan includes the services and resources you and your family need for good health. But sometimes you may find yourself lost in all the lingo. Certain terms may commonly pop up in your healthcare benefits, and when you come across them, it helps to know what they mean. This way, you'll be sure to understand and make the very best choices when it comes to your health. Common healthcare terms. Let's get started. One of the first terms you'll see a lot is deductible. Your deductible is the amount you'll need to pay in qualified healthcare costs before your benefits plan coverage begins. In other words, it's the amount you pay before your health plan pays. Your deductible is based on a plan year, which could also be a standard calendar year or a 12-month period. It's helpful to know your deductible resets at the beginning of each new plan year. Also, not everything applies to your deductible. Some healthcare services count towards it, and some don't. You can find all the details by reading more about your healthcare plan in your benefits booklet. In addition to your deductible, you'll come across some other terms. Your copay is a cost shared between you and your health plan, based on a flat dollar amount. This is the amount you pay up front when you visit your doctor or specialist, or the amount you pay when picking up prescriptions. Because of this flat rate, the amount of your copay does not change based on what a healthcare provider bills for a service you receive. It's important to note your copay does not count towards your deductible. The amount of your copay and whether or not you'll need to pay one are all based on how your health plan is set up. Your provider network is a group of doctors and healthcare providers who have agreed to offer discounts on services. When you visit them for your care, you'll often save on the cost of that care. So, let's say you've met your deductible. Now you may see another term. Your coinsurance is a cost shared between you and your health plan based on a percentage. For example, if your plan covers a doctor's visit at 80% and you've met your deductible, that means you'll be responsible for the remaining 20% of that bill. This 20% is your coinsurance, and unlike a copay, your coinsurance fluctuates depending on what a healthcare provider bills for a service. For example, if your office visit is $100 and you've met your deductible, you would pay the remaining 20%, or $20. What happens if you or a family member needs a lot of healthcare services after you've met your deductible? Well, so glad you asked. For this, you'll likely become familiar with another term, your out-of-pocket maximum. Despite the percentage of costs being covered by your benefits plan, your costs for care can add up. Because of this, plans include an out-of-pocket maximum. This is the most you'll need to pay during the plan year for healthcare services. Once you reach your out-of-pocket maximum, your care is covered at 100%. Some restrictions apply, so it's always best to consult your benefits booklet to learn more. Have questions or run into any terms we haven't covered? That's okay. You can always check with Meritain Health Customer Service to learn more.